Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about chronic fatigue syndrome. In particular, I will cover what is chronic fatigue, how do you treat it, and how can you live better with chronic fatigue syndrome. So first, what is chronic fatigue syndrome? Chronic fatigue syndrome is a complicated disorder characterized by extreme fatigue that may worsen with physical or mental activity, but doesn't improve with rest. Although there are many theories about what causes this condition, ranging from viral infections to psychological stress, in most cases the cause is still unknown. Because its symptoms are difficult to measure, CFS wasn't widely accepted as a real medical condition for several years. Today, however, doctors and researchers agree that this condition should be taken seriously. Although an underlying cause often isn't found, effective treatments for the signs and symptoms of CFS are available. Many people recover from chronic fatigue syndrome over time. People with CFS may experience a variety of signs and symptoms that come and go frequently with no identifiable pattern. So the primary signs and symptoms would be they have 8 official symptoms plus the central symptom that gives the condition its name, fatigue. Then there's loss of memory or concentration, sore throat, painful and mildly enlarged lymph nodes in the neck or armpits, unexplained muscle pain, pain that moves from one joint to another without swelling or redness, headache of a new type, pattern or severity, unrefreshing sleep, and extreme exhaustion lasting more than 24 hours after physical or mental exercise. Of all chronic illnesses, chronic fatigue syndrome is one of the most mysterious. Several possible causes have been proposed, including depression, iron deficiency anemia, low blood sugar, history of allergies, virus infection, such as the Epstein-Barr virus, and dysfunction in the immune system, changes in the levels of hormones produced in the hypothalamus, pituitary or adrenal glands, mild chronic low blood pressure. So women are diagnosed with CFS at least 4 times as often, but sex isn't a proven risk factor for this condition. It may be that women are simply more likely to report their symptoms to a doctor. The condition is most common in people in their 40s and 50s, but it can affect people of all ages. Because the cause of the condition is unknown, doctors have yet to determine and confirm definite risk factors for the disease. So next is, how do you treat chronic fatigue? There's no specific chronic fatigue syndrome treatment. In general, doctors aim to relieve signs and symptoms by using a combination of treatments which include moderating daily activity. So your doctor may encourage you to slow down and to avoid excessive physical and psychological stress. Next would be gradual but steady exercise. Research has proven that gradually increasing exercises can improve the symptoms of CFS. Next would be cognitive behavior therapy. This treatment, often used in combination with graduated exercise, also has been found to improve the symptoms of CFS. Treatment of depression. So if you're depressed, medications such as tricyclic antidepressants and the serotonin reuptake inhibitors, the SSRIs, may help. Antidepressants may also help improve sleep and relieve pain. Treatment of existing pain. You can use paracetamol and non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen. They reduce pain and fever. For treatment of sleep problems, changing your sleep habits may be enough to help you get started for a restorative nighttime sleep. Treatment of allergy-like symptoms. Antihistamines and decongestants may relieve allergy-like symptoms such as runny nose. And treatment of low blood pressure. The drugs fludrocortisone and atenolol may be useful for certain people with chronic fatigue syndrome. Treatment for problems of the nervous system. Symptoms such as dizziness and extreme skin tenderness can sometimes be relieved by clonazepam, plus lorazepam and alprazolam are used to relieve symptoms of anxiety. And finally, how do you live with chronic fatigue syndrome? Learning how to manage fatigue can help you improve your level of functioning and your quality of life despite your symptoms. These important self-care steps can help you to maintain good general health. So reduce stress, develop a plan to avoid or limit overexertion and emotional stress. Allow yourself time each day to relax. That may mean learning how to say no without guilt. Get enough sleep. Getting sufficient sleep is essential. In addition to allotting enough time to sleep, practice good sleep habits, such as going to bed and getting up at the same time each day, and limiting daytime napping. Exercise regularly. You may need to start slowly and build up gradually, but exercising regularly often improves symptoms. And stretching, good posture and relaxation exercises can also be helpful. Next would be pace yourself. Keep yourself active on an even level. If you do too much on your good days, you may have more bad days. Next would be maintain a healthy lifestyle. Try to get a balanced diet, drink plenty of fluids, limit your caffeine intake, stop smoking, get adequate rest, and exercise regularly. And find a hobby or career that's enjoyable and fulfilling to you. Finally, before I finish, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist in managing chronic fatigue more effectively. To start with, we have numerous products to get you set up and started on an exercise program, such as exercise ball, floor mats, weights, and various other necessary equipment required to get you started on a program tailored to you. We also have various supplements which you can purchase from us without a prescription, such as Korean ginseng, multivitamins, fish oils, omachar, baraka. And so that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing chronic fatigue with confidence. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.